Hey there. What if I told you that recessions, save lives? Imagine the worst financial crash of your lifetime. People losing jobs, homes, savings, entire futures. You'd think death rates would skyrocket, right? Except mortality actually fell, and not by a little. What a surprise! The hardest hit areas saw the biggest health improvements that lasted for 10 years. Welcome to the Great Recession plot twist nobody was ready for. Back in 2000, economist Christopher Room dropped a bomb. When unemployment goes up, deaths go down. Bro, what? But his data was rock solid. 1% extra unemployment resulted in 0.5 to 0.6% fewer deaths. He called it pro-cyclical mortality. People literally die more when the economy is booming. This sounded insane until the Great Recession happened in 2008, which, changed everything. Fast forward to 2023. Researchers asked more than 300 health economists, what did the Great Recession do to mortality? Half predicted more deaths. Only 27% predicted fewer. 93% were too pessimistic. Reality slapped everyone. For every 1% rise in unemployment, mortality dropped 0.5% immediately and stayed lower through 2016. Median unemployment jump, 4.6%, meaning 2.3% fewer deaths each year, equivalent to giving 1 in 25 people age 55 an extra year of life. Some regions got absolutely wrecked. Sand states: Florida, Arizona, Nevada, California. Rust Belt: Michigan, Ohio, Indiana. In the worst quartile, they experienced 6.7% unemployment. The least affected areas only had 2.9%. Irony: places hit hardest economically got the biggest health boost. What was the mortality timeline? Before the crash, hardest-hit areas had higher mortality. During the 2008 crash, mortality drops instantly. During recovery, mortality stays lower with no catch-up. These were real, persistent health gains, not borrowed time. Cardiovascular disease, biggest drop, nearly half of all lives saved. Traffic deaths, fewer people driving means safer roads. Suicides, yes, they went down. Shocking. Liver disease, small decline. Cancer, literally 0% change, perfect placebo check. Even deaths of despair fell. Total plot twist. Percentage declines in mortality were similar across ages, but elderly have much higher baseline mortality. Result: 75% of lives saved were age 65 plus. They didn't lose jobs. Their incomes were stable, meaning the benefits came from environmental changes, not personal ones. This one is wild. People with high school or less got 100% of the health gains. People with college or more got nothing, 0%. Less educated Americans suffered economically, but breathed cleaner air. Recessions hurt wallets, but help hearts, especially for the most disadvantaged. One secret mechanism explains the puzzle. Hard-hit areas saw the biggest pollution drops. Cleaner air persisted for years. Air pollution declines explain 20 to 40%, possibly all, of the mortality reduction. Factories slowed, roads emptied, electricity demand fell. Cleaner air leads to healthier hearts, which in turn means fewer deaths. What factors did not reduce mortality? Not self-care. No big exercise or diet changes. Not alcohol, small effect. Not nursing homes, no staffing or quality change. Not infections, flu, pneumonia unchanged. Mechanism is external, environmental, not people improving their habits. How is this effect changing over time? Strong pro-cyclical mortality in 1970s to 1990s. Weaker relationship in 2000s to 2010s. Cardiovascular and traffic still decline in recessions, but new countercyclical effects appear, such as an increase in drug overdoses. The Great Recession still showed strong health gains, but patterns are evolving. What do we know about global link between recessions and mortality? In rich countries, recessions reduce mortality because of strong safety nets, cleaner air. In poor and middle-income countries, recessions increase mortality because lost jobs means lost health care. For example, in Brazil, over 2014 to 2016, mortality rose among working-age men. Areas with high social spending, avoided the spike. The global lesson: social protection determines health outcomes during downturns. Traditional econ says recessions reduce lifetime welfare by about 2%, but add mortality benefits and costs drop for all age groups. Starting from age 65, recessions, no longer lower welfare. Mortality is that powerful in welfare calculations. If recessions save lives by cleaning air, we don't need recessions. We need clean air. Pollution is massively underregulated. Less educated people bear economic pain, but receive health benefits. This is an unjust trade-off. Public transit and green energy are hidden lifesavers. Don't rely on recessions for cleaner air. Regulate instead. But many open questions remain. Do benefits last 20 to 30 years? Do mild recessions have same effect as the big ones? What about COVID recession when mortality increased? How do individual job loss harms fit aggregate benefits? What about mental health and chronic disease? Many mechanisms still unclear. Research ongoing. The Great Recession revealed how deadly normal pollution is. Health didn't improve because life got easier. It improved because the environment changed. A tragic natural experiment showed the power of clean air. Imagine two neighborhoods, one booming and polluted, one slowing down and breathing easier. Recession didn't save people. Clean air did. And the biggest beneficiaries were people who already had the least. When the world slows down, people breathe easier. We shouldn't need job losses for that. Clean air should be intentional, not accidental. Environmental policy is health policy. What shocked you more? The suicide decrease or pollution explaining half the lives saved? Tell us in the comments. Subscribe for more stories where data flips what you thought you knew. Let's uncover the hidden side of the world together.